Hi, my name is Catherine. I'm going to do a head-to-toe assessment of you today. Before I get started, I'm going to wash my hands. Can you tell me your name?
Hannah,
Where you are?
my house,
And today's date.
Friday.
Patients alert oriented ×3 and are experiencing any pain on a scale of 0 to 10, 10 being the worst.
0.
Patient denies any pain. Next, I'm going to inspect your scalp now. Okay, hair is evenly distributed, no signs of hair loss and no signs of head trauma. Next, I'm going to inspect your ears. Ears are symmetrical. I'm going to inspect for any skin breakdown of your ears. No signs of skin breakdown. Next, I'm going to check for any drainage. No signs of drainage. Next, I'm going to inspect your face. Face is symmetrical, smooth, and skin is correct for ethnicity. Next, I'm going to inspect your eyebrows. Eyebrows are evenly distributed, no signs of hair loss. Eyelashes show no signs of hair loss, and eyelids show no signs of ptosis. Next, I'm going to inspect your conjunctiva. Conjunctiva is pink and moist. Next, I'm going to inspect your sclera. Sclera is white, no signs of jaundice. Next, I'm going to check for your corneal reflex. Look at my pin light. Good. Corneal reflex is present. Next, I'm going to check for your pupils. Pupils constrict to light. Can you follow my pin light? Good. Pupils are equal, round, reactive to light, and accommodate. Next, I'm going to inspect your nose. Nose is symmetrical, no signs of trauma. Can you lift up your head like that? No signs of drainage. Next, I'm going to inspect your lips. Lips are pink, moist, no signs of cracking. Can you smile? Frown? Puff out your cheeks? Cranial nerve 7, facial nerve is intact. Next, I'm going to inspect inside your mouth. Open your mouth. Buccal mucosa is pink and moist. Teeth shows no signs of caries. No signs of gingivitis on the gums. Can you stick out your tongue? Cranial nerve 12, hypoglossal nerve is intact, and tongue is pink and moist, no signs of white patches. Can you say ah?
Ah.
Cranial nerve 9 and 10, glossopharyngeal and vagus nerve is intact. Soft and hard palate is pink and moist and intact, and tonsils are not present. Next, next I'm going to inspect your throat, your neck. Neck shows no signs of lesions. I'm going to palpate for any lumps. No signs of lumps. Next, I'm going to palpate for your carotid pulse. Carotid pulse is +2 straight and is bilateral. Next, I'm going to check for your skin turgor. Skin turgor is elastic, no signs of dehydration. I'm going to inspect your respirations now. Respirations show no signs of labored breathing, no signs of shortness of breath. I'm going to auscultate your breath sounds now. Each time I move to a spot, please take a deep breath with your mouth open. Deep breath. Deep breath. No signs of crackles or wheezes. Next, I'm going to palpate your apical pulse. Your apical pulse is on your left side, 5th intercostal space, mid-clavicular line. Apical pulse is palpable. I'm going to listen to your apical pulse for a full minute. Apical pulse is normal rhythm. I'm going to auscultate your heart sounds now using my diaphragm first. I'm going to start at your aortic valve. Your aortic valve is on your right side between your second and third intercostal space. Now I'm going to listen to your pulmonic valve. Pulmonic valve is on your left side between your second and third intercostal space. I'm going to listen to your tricuspid valve now. Tricuspid valve is on your left side between your fifth and sixth intercostal space. And mitral valve. Mitral valve is on your left side on your fifth intercostal space, clavicular line. I'm going to listen to these same spots again, this time using my bell. Aortic, pulmonic, tricuspid, and mitral. Okay. No sounds of gallops or murmurs. Next, I'm going to inspect your abdomen. Abdomen is flat, symmetrical, shows no signs of lesions, shows no signs of bruising or rashes. I'm going to first auscultate your bowel sounds, starting at your right lower quadrant. Using my diaphragm, I'm going to start the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are active in all four quadrants. I'm going to palpate your abdomen now. If you're experiencing any pain, please let me know. Light, deep, any pain? Light, deep, any pain? Left upper quadrant, light, deep, any pain? Left lower quadrant, light, deep, any pain? Patient denies any pain, no signs of mass. Now I'm going to inspect your upper extremities now. Upper extremities shows no signs of rash, no signs of bruising or lesions. Joints are equal bilateral and symmetrical. Next, I'm going to palpate for your upper extremities body temperature. Upper extremities body temperature is warm and is equal bilateral. Next, I'm going to assess your strength. Put both arms up for me. Push against my arm. Good. Grip on my finger. Good. Strength and grip is present, it's equal bilateral. Next, I'm going to assess your radial pulse. Radial pulse is +2 strength and is bilateral. Next, I'm going to assess for your capillary refill. Capillary refill is rapid and is less than 3 seconds. Next, I'm going to assess your lower extremities now. Lower extremities show no signs of bruising, no signs of rash. And joints are equal bilateral and symmetrical. I'm going to palpate your lower extremities body temperature now. Lower extremities body temperature appears warm and is equal bilateral. Next, I'm going to assess your strength. So just push against my arms. Good. Flex your right foot, left foot. Strength and flexion is present, it's equal bilateral. Next, I'm going to test for any pretibial edema. No signs of pretibial edema and shows no signs of indentations. Next, I'm going to palpate your dorsalis pedis pulse. dorsalis pedis pulse is +2 strength. Next, I'm going to palpate for your posterior tibial pulse. Posterior tibial pulse is +2 strength and is present. Next, I'm going to assess your capillary refill on your great big toe. Capillary refill is rapid, it's less than 3 seconds. I forgot to check for your body temperature earlier, and I'm going to do that right now. Body temperature is 1, is equal bilateral. Do you have any questions for me today?
No.
Okay, thank you, and have a good day.